Wow, I have a lot to say in a very short time, and I can see my hour is running. Okay, not yet, so we'll not count it. Yeah, so I spoke to Pastor Pauline for the first time, I think one week ago or 10 days ago. And let me tell you, Pastor Pauline loves you women so much. Yeah, my God, she loves you so much. So when we were speaking, she told me that, I think, why don't they send questions and then you can prepare? And I was like, okay, let's do that. And then she sent me 28 questions on WhatsApp. And I was like, okay, 28 questions, 40 minutes, no problem. And then we looked at the questions and we realized that 60% of your questions were actually on vaginal health. There was a 10% on fibroids, there was a 10% on PCOS. Of course, fertility is a common question. But I was really, really surprised that 60% of the questions was on vaginal health. And because she sent me this on Tuesday, I went to work and I got you this. Yeah, this book is an answer to your questions. And I really cannot thank you enough because I've been sitting on, God has been telling me to write a book for the last 5 years. It took your questions for me to actually sit down. So please clap for yourselves for allowing me to honor what I know is in my heart, and I'm really grateful. So that's just a way of introduction. So for now, can we start? We switch to medicine? You are sure? You're ready? Okay, let's stand up. Let's stand up, everyone. Everyone. I want us to walk around like the real women. Let's walk around. Yeah? Walk around. Okay, I can see you're walking, everyone. Now let's run around. Let me see those who can jog on the spot. Jog on the spot. Yes, I can see you. I see you. Okay, then stop. Stop, everyone. I want you to go around. See yourself. See this beautiful creation that God made. Do you love what you see? Do you love what God made? Can you strut? Tell them, see me. See me, yes. Let them see you. Yeah. Because beyond those clothes is a beauty. Tell them I'm a beauty. Hey, I'm a beauty. Yes. So now you can sit down and talk about this beauty. Okay? We talk about this beauty. Yeah? Beautiful women of the Lord, I see you. So I had prepared quite a long presentation. Okay. So I had prepared a long presentation, but while we were in the office, I was reminded again that the topic today of interest is for you to know what's normal. Yeah, that's what you asked me to talk about. What's normal and what is not. Okay. So today, with your permission, Mike, just leave it there. Show me the other one, if you can. Leave that alone. Those are semantics. Yes. Yeah. I want this image. Just blow up that image and leave it. We're going to talk from my head because the Lord gave me an intelligent brain. Amen? Yes. So we are not going to be talking about PCOS. We will in a short segment. But I want us to talk about, with your permission, the vagina. Okay? Can I say vagina? Does it spook you out? Or do I say hoo-ha? The V word. Do I say those ones? Coochie. Those things. No, we're going to talk about the vagina. Okay? Because if we are women, we all have a vagina, isn't it? Yeah? And what's the role of this vagina, if someone knows? Anyone? You're all shy. Okay. No problem. I'll speak it for you. We know one, childbirth. Yeah? And we've been told not to identify ourselves by those we pushed out. Right? But the number one role of that vagina is childbirth. Do you give birth every day for the... Okay, first, who's married? Because I'm going to go into very deep topics. Everyone, okay, I can see a couple of numbers. Who's praying for marriage? Good. You are the right people to talk to before you get there. Yeah? So today I'm going to talk about the vagina and I'm going to talk about sexual intimacy at length, with your permission. Sindio? Alafu kesho msiniangalie vibaya. Sindio? Thanks. So the vagina is part of the human anatomy. It is actually about 10 to 11 centimeters. Yeah? Do this to your hand. Do this to your hand. That's the length of your vagina. This usually is about 12 centimeters depending on your height. Yeah? So this is literally the size of your vagina. It's not that thing you see down there. Okay. So we have a door. You know when you're driving to your driveway, amen? And then you have a gate, and then you open, and then there's a driveway, and then there's the door, and then there's the house. See, that's how most houses are that we are dreaming to have, or that we have at home. So that driveway is a vagina. That gate ukonje is the introitus. Okay, what we call the introitus, what you see. Okay? And then we have the gate, the front door gate is called the cervix. Sawa. And then you have the house. See there that looks like a V? You can see that V up there? That house is called the uterus, which is the womb. Okay? The womb. And you carry so much more than just a baby. That womb carries so much more than just the baby. Okay? And we were told there are shadows. I hope I got that right. There are shadows and then there's the real one. I forgot the name of the real one. So we are spiritual wombs. But the physical one looks like that. Okay. And then we have a factory. See that white thing over there? Are you seeing that looks like an oval? That's the ovary. Okay? That ovary carries all the hormones that make you feminine. Okay. The estrogen, the progesterone, the follicular stimulating hormone, all those things. Most of them work at this ovary. Okay. So which means if an ovary is removed, you're not less woman, but you have less hormones, which makes you very irritable, which is why menopause happens. Okay, but we'll explain that. And then you have the tube. Are you seeing a tube? It's something that looks like this. That's the fallopian tube. Okay. And what I've described here is a sexual, or rather the female reproductive organ. Okay? The female reproductive organ. Have I talked about the bladder? No. Have I? Have I talked about a urethra anywhere? No. Why? Because we all have them. Men and women all have it. Okay? They're different, but they're there. Okay. So when we say a UTI is a problem of women, are we really being honest? Are we really being honest? Yeah. Okay. So I should have given you an image showing you where the bladder, the urethra is. I don't know if, Mike, you can just pull it up the internet. An image showing the bladder, the urethra, the uterus, and the rectum behind. And that will be important for you. It will help you understand why we get more UTIs as women, why you get UTIs that have stool sediments in them, why we tell you to wipe front to back. Okay. So when you see the anatomy, it will make sense. Okay. But today we are discussing about, okay, this is one, and then you'll get me now a blown up of the cut section. But here we are. I need you to know this image. Don't remove it fast, Mike. I need you to look at this image. I want you to cram it. Because most of you, do you have a mirror at home? Have you ever looked at yourself down there? Have you? Even once? I can see some yes. Those who haven't, why? Why? Do you wash your face? Do you wash your tummy? Then why don't you? It is outside. Why don't you know how it looks like? Because it is a sin. Sindio, it is shameful, isn't it? To get a mirror and look at yourself. Right? Right? It is, it is a God-given gift. Okay. Without this, as it looks like, there are very many issues that we as gynaes treat. Without this is normal anatomy. Okay. So because we are appreciating and understanding our bodies, tumeambiwa initial, the real you are koko nyuma. But now if you're given a house and you don't know where the bathroom is, or the sitting room, are you taking care of that house? Are you being a steward of that house? Si hata mimi nikikuja na kunyang'anya hiyo nyumba, hauitumi? Si ndio? Yeah. So I need you to at least understand. There's a clitoris up there. Then there's the urethra. Urethra is where urine comes from. Okay. Okay? Then below it is the introitus, or the vaginal opening. Understood? Remember how many centimeters is it? 10 to 11. Okay. So that's really just the opening. Okay? And then down there, you can see the anus. What comes out of the anus is poop. Okay. Look at the distance between the urethra and poop. Are you seeing how short it is? Okay? And then you've gone to the washroom, holy woman of God. You don't want to get down there, so you've taken tissue and tupad and left. Sindio? So what do? You transfer from anus up there. Sindio? And then what do you get? What do you get? A UTI. Okay. Okay? Or you can also get a vaginal discharge. Not very common, but you can. Okay. So when we tell you to wipe front to back, go with me. What is on top? Clitoris, then urethra, then vagina, then anus. Whether you have gone for a short call or a long call, the method is the same. You move from up, down. And you can know your clitoris because it's a bump. It's this big. It's this. It's like it's a triangle, ideally. Yeah? And people are different because you all look different. Those are big, those ones are small. It doesn't matter. Top, down. You understand? Top, down. I have solved 40% of your gynecological issues. 40, just by that one method. You understand? Okay. Next scenario, I'm really not going in order, but tumesema tunaenda tu, we flow. Again, anatomy. Where is the vagina? You've seen where the vagina is. It's at the center. If you are married, please, and only if you are married, you are going to have something called coitus, using medical terms, with your husband, right? Why? Because it gives you emotional and spiritual connection. Okay. But what is meeting? Physical. Sawa. So the physical will go through the vagina. Okay. What is above? The urethra. So then does it make sense why it's possible for you to pick up a UTI after sexual intercourse? Does it make sense? Because it's literally like 2 or 3 millimeters above. Okay. And then because you had not seen each other for 3 weeks, you can imagine the intensity. Are you seeing how you're going to get a UTI? Or like a cut? Okay. So all that will happen because of proximity. Okay, it's all proximity. Now, I don't know if we can get a cut section of this to the bladder so that I show you the length. Okay, yes. So are you seeing the bladder? The bladder is this yellow thing. Are you seeing yellow, everyone? There's something there written, proximal urethra, distal urethra. You see? That whole thing is 4 centimeters. 4 centimeters is this much. Like from your finger till here, for most people. Are you seeing how short that is? Okay. So because of that length, that short length, then it's very fast for something to go up. So if you are, for example, having, let me use washroom, you used a shared washroom and picked up bacteria, that bacteria can move up 4 centimeters very, very fast. Okay. And so you go to the washroom yesterday, today, you're having a burning sensation. Sawa. Why? 4 centimeters. The other thing, this bladder has a capacity of 500 mLs. 500 mLs is almost that jug. Okay, that's a liter, half of it. Okay. So 500 ml, no kumkele soda Fanta. Kale kanono, you seen it? That's 500 ml. That's a lot. Okay? So if you're not, but it can go all the way up to 6 liters. Please don't do that to your bladder. Please. So, but at around 600 milliliters, your body will start telling you that now I am full, I need to pee. But because you're busy, you're in a conference like me, you're speaking, and you can't go to the washroom, it stays, it sits for however long I sit here. Or you're trying to finish something in the office, or the baby is just crying, he needs to sleep fast, and then you can go deal with your issues. It stays. So what happens? All the bad things in your body, the toxins, come out through either the liver or the bladder. Okay, the kidneys or the liver, then it's pushed out through bladder. Okay, so all those toxins come to the bladder and then they sit. You took breakfast at 8 a.m., then maybe that's when you went to the washroom. 9, 10, 11, 12, 1, 2, 3. You remember when you're going home that you needed the washroom. So now it's 4. Those are 8 good hours. You know what you've been doing? A factory of bacteria. Okay. So you keep doing that. You still feeling pressed, but you're not releasing. So because you're not releasing, 1, you're creating a factory of bacteria. Okay. Number 2, you are making that bladder wall stretch over and beyond its limit. Okay. So you start feeling pain. Okay. And then now you go, by the time you're going, because now it's a factory, what does factory produce? Heat. Sindio? See, every factory inapita na kwanga na moshi. So you go, you're going to pass urine, what are you feeling? Burning sensation. Okay? And then there are ways we know what type of an infection you have. Is it at the beginning when you're starting? Is it in the middle? Is it at the end? I'll tell you all that later. But not going to the washroom is doing you more harm than going to the washroom that is shared. Okay? Not going to the washroom. And then there are those ones like me. Me who is your teacher who needs to do better for her life. Who drank water the last time in the morning. Me. I'm so busy, I'm running to Mpisha. After that, I went to Third Park, and then I came, and then, nimekunywa maji? No. So what happens? Toxins are still being removed. My body is still working, right? So you get very, very concentrated urine, okay? And you know what happens with concentration of toxins? So if you want to poison a rat, let me use that as an example. So mnanunua alafu mneka kwa chakula, I'm hoping, I'm assuming. Then mneka. Isipokufa, what do? You buy more. Sindio? Unenda alafu uneka kwa chakula kidogo. Yeah? I can see people who have not lived in the village. I can see you who don't have sacks of maize. But you get. So when you have small quantity with a lot of toxins, it's able to actually do more harm to you. Okay. So then you end up forming a stone. Anyone here who's ever had a urethral or a kidney stone? Anyone? Please thank God. It is one of the most painful things you can ever... Sometimes people say it's worse than labor. It's that bad. Why? Because you don't drink water. Okay? So small things that have very easy solutions that are hurting us. Okay? Okay. So can I now go back to you can pull me back to the vagina. Just give me a blow-up image of the female reproductive tract. That's what you'll put on Google. Just blow it up by itself. Female reproductive tract. Sorry, I'm making you my assistant. So sorry. Anyway, so back here. So the vagina, I need you to understand your vagina. One, it's elastic. It's very, very elastic. How do you know it's elastic? Who here is a mother? Anyone here who's a mother who delivered normally? Yeah? Good. Have you seen the size of your husband's head? And then have you seen what came out of you? Have you seen? Have you seen? But it's back to normal. Okay? It's elastic, very, very elastic. Those who are not married, please look at the size of his head. It will help you. Tips. Okay? So, but look more at his heart. Tafadhali we're in church. You look at his heart and you pray and ask if he's the one. Anyway, so I've remembered about the fool, the rich fool. Please don't marry a rich fool. Guy! Please don't marry a rich fool if you're not married. If you already are, tell God to help you. He helped Abigail. Anyway, that's besides the story. So we are back to the vagina. One, it's elastic. It's long. It's H-shaped. May not be necessary for you. But for us, when we're doing a speculum, we actually insert something that looks like this. I don't know if... who here has done a pap smear? Who here does not know what a pap smear is? Okay, thank God. Oh, okay, no worries. We are here today for you. So we usually open to get to the vagina. So, no, to get the cervix. You can see the length. Thank you. So you can see the bladder, the urethra, the length of the vagina, and then the cervix. And that's how, at any time, your uterus is shaped. It either falls in front or falls backward. Okay? If it falls backward, you may have a bit of discomfort or a bit of pain and pressure, especially when you're having penetration that's a bit deep. Okay? So sometimes it can come with painful sex, although it's a variation. Some women naturally just have retroverted uteri, or during pregnancy, if you had a big baby like me, the uterus can fall back because of lack of support. Okay? But this is the natural position of the uterus. Behind it, you can see the rectum. Okay? So what comes out through that small hole down there, but what is stored is there in the rectum. That can also give you a lot of pain if you don't go to the washroom often. If anyone here has ever been constipated, you know how painful it can be. And now if you try and do any activity, even giving birth, sometimes, or in fact most times, when we're giving birth, you will have to pass stool first to create space for the baby to come out. Okay, and also pass urine. But anyway, so you can see that length as it is. That length is made up of elastic tissue, and it has mucus glands. Very many mucus glands. What is the role of this mucus gland? Number one, it is to, remember this is a tract, it's a driveway. It is to make sure that area is lubricated. Okay? Number one. Number two, it is to clean that area. So when you ask me, there was a question on the chat on, is it normal to have discharge every day? Okay? How many times do you shower? Okay. How often do you shower? I'm assuming at least daily, right? Okay, so if you shower daily, do you think God had the wisdom for your vagina to clean itself daily? Yeah? Yeah. Okay, so when you see a discharge almost daily, is it normal? Yes or no? Okay, yes or no? So, okay. So the vagina cleans itself daily, okay? The same way your urine tract is cleared out every 6 hours, but also daily, okay? The same way blood pumps throughout your blood, okay, that one that happens per minute, but you understand, God is very systematic. Very, very systematic. He understands our bodies, and he has designed the body to self-heal. Okay. Now, so, however, remember the ovaries that I showed you earlier? The ovaries have activity on the cervix. The cervix is the front door. You can see it. You can see the cervix, right? Okay. So this cervix has two main roles. Actually, three. But the first one is to protect the upper female tract. Okay. So it's sealed. It's actually a gate. It's the most, if you are to design a gate, please look at the cervix. Because it does this and then it closes. When we say you're 10 centimeters dilated, are you seeing that thing that is small there? It opens up to 10 centimeters. And then you say you don't, believe in this God who made us. 10 from that. From a millimeter. Are you understanding? And then it comes and closes itself fully. Like even sperm cannot go through. It's that amazing. And you know how big a sperm is? It's a nanometer. You have to use a microscope to see sperm. Okay? But this cervix can lock out sperms. Okay? So it's that dynamic. But because of its dynamic nature, then it releases fluid according to the hormonal pattern. Okay? So if you are female and you've started your menstrual cycle, you know on the first day you bleed. Okay? Then you bleed for maybe 3-4 days. Normal is 5 days, plus or minus 2, to answer some of your questions. So if you bleed for 3 days, you are normal. If you bleed for 7 days, you are normal. Okay? If you bleed for 9 days, it is not normal. Okay? If you bleed for 1 day, it is not normal. Okay. And how much do you bleed? 20 to 80 ml. It is not that much. Understood? 20 to 80 ml may be less than this. I think this is 200. Yeah. So it's a quarter of this. Okay? Wait, my hands. I'm just... yeah. So if you find that you're bleeding and it has clots, I don't care whether they are small, I don't care whether they're on day 2 or 3, they are not normal. Why do I say so? If you are clotting, it means that your body is unable to cope with how much blood you're losing. Therefore, it has kicked in the clotting mechanism as when you fall down. You understand? So anytime you start seeing clots, especially if you are not seeing them before, then there's a problem. And it's the number one way of actually telling whether you have something growing such as fibroids. Okay. Or adenomyosis or any other. Understood? So clots are not normal. Okay. So blood, the life-giving in our lives, is neutral. Okay. Mnakumbuka chemistry tulikuwa na acid, bases, and neutral. Do you remember? Mnakumbuka? Yeah, it was not for games, it's true. So our blood is neutral in terms of pH, and it has to be because it traverses the whole body, and the body has different electrical balances depending on where you are. Okay. The vagina, this vagina is acidic, and with a reason. Which other organ do you know that is acidic? Let me see, biology people, biology. Stomach, good. So the stomach is also acidic. You know what's common between them? They receive foreign material. You understand? So because they receive foreign material, they have to be able to kill it off. Okay. So you have HCl in the stomach, and then here you have a bacteria that is good, that is called lactobacillus. Okay. Lactobacillus. There are 4 types, doesn't matter. The ones that are important are lactobacilli. They create a space in which that area is acidic. Okay. So if you have a baby who's below puberty, they don't have an acidic pH. Okay? If you're postmenopausal, it is likely not very acidic. Understood? Because that whole system is triggered by the ovary. Okay. But it has its own good microbiome. Very important for you to know. So that you understand that it is not a vacuum. You understand? It's not a vacuum. It has yeast, it has bacteria, sometimes it even has parasites. Okay. We call them protozoa. But it has all those things. What keeps it in check is that acidic pH. Understood? And what creates that acidic pH is that lactobacilli. Now, you've taken an antibiotic for any other reason. Ulikuwa na homa, ujaenda hospitali, umeingia pale pharmacy, give me azithromycin. We know you. We understand you. We are you. Okay? So you've taken an antibiotic, most likely self-prescribed, or you've gone to hospital and it's actually been prescribed. So what happens is that, do you think this antibiotic knows I need to go to the lung only? Do you? No. There are those ones who have activities more in the lung, more in the gut, more wherever, but they work across the body. Okay. So if it's working across the body, will it kill off lactobacilli? Yes. Okay. So then does it make sense why anytime you have a cold and then you've taken antibiotics, you get an infection? Okay. What infection do you usually get? I'll say it so that you stop looking at me. Munaniangalia like, kwani tulikuja class? Did we come to class? You get a white discharge. Sindio? Yeah? I'm talking about me, not you. Those ones out there, they get a white discharge. You smell like roses. Sindio, not you. I'm talking about those ones out there. So those ones out there, they get a white discharge. And it goes to and stains their panty. Sindio. And when it stains their panty, sometimes it actually burns. And it actually burns. Or it looks like curdled milk. And I know you here are vegetarians. Sindio, wadoa cabbage, nilisikia, we are trying to work hard, right? So you and rabbits, same was up. So those who take milk, when you boil milk, it has that white, creamy thingy on top, right? So that's how, and then it sticks. That stickiness, when you see it, and when you put it when you look at your panty, it looks like it's cracking, for lack of a better word, at the end of the day. That is most likely yeast. Okay, so you get yeast when there's an issue with your pH balance. Now, I'll tell you the things that will give you that issue. Number one, you got a UTI, okay? You have antibiotics, but this one is a kicker. You have just met with your husband intimately. Okay, that can give you a discharge. Why? Let me guess. Someone, guess for me. My biology student? Someone? It has to do with chemistry, purely. He did not cheat, purely. Something. Nisaidiane, acha niwasaidie. Uko nje, those women out there, when they met with their husbands, not you're holy. Sindio? Anyway, the semen, the pH of semen is actually alkali. It's 7.8. Okay. And that of the lady, the vaginal tract is 3.5. That is the pH. 3.5 to 4.5. Okay. So when you mix an alkali and an acid, what do you get? For those who don't know, you get a salt and water, but you also get a pH that is slightly more towards neutral. Okay, so that pH that's slightly more towards neutral is conducive to giving you things like bacterial vaginosis, which is a bacteria that has grown higher than the lactobacilli, or it can give you yeast. Okay, so if you've met with your partner and for whatever reason you're finding a day or two afterwards you have a discharge, it could be because of this pH issue. Okay, and it clears by itself after a day or two. When should you be concerned? The normal discharge of any female, myself included, is clear. Okay? It's usually clear. It's whitish. It's not thick. Okay? It's not thick. It's like milk. Remember the land of milk and honey? There's a reason. There's a reason. Yeah, so it's like milk. Okay. And it changes as the month goes. When it's closer to ovulation, it's actually clear completely. It's not milky, it's clear completely. It looks like water, and you can stretch it up like that. So for those who've been wondering, family planning, how do I know my safe day and my not safe day? When you do this and you do that, it's not safe, guys. It's not safe. Unless you want a baby, then it's very safe. If you want a baby, that's the day. That's the day you're like, hey, husband, where are you? I have cooked your favorite dinner. Huh? And because there was a question on fertility, please, if you ever tell your husband, the doctor said today is the day, they will not perform. Okay? They will not. Even that sperm will get scared. It will go backwards. I kid you not, sperm moves backwards. Yeah? So what you tell them, when you go to the doctors and you're on fertility treatment for whatever reason, and then, or you are trying naturally, and you've been following your safe days, and now you've been told it's fertile. Like your app, I hope you have an app. I hope. Okay. And your app has told you it's a fertile day. All right. What you do is you make nice dinner. Remember submission? You look nice. You start texting in the morning, hi babe. Today you look so glorious. You know, by the time he comes home, he's like, I've made your bath for you, or a shower, who knows. You get? You serve him his meal. You wait for him to watch his favorite sport. You pray they win. Okay? And then you meet in the evening. Zero pressure. You understand? Babies don't like pressure. Imagine they just said this sperm and this egg sense that mom is stressed. Physiologically, you release cortisol. Cortisol is a stress hormone. Cortisol goes against the feel-good hormone, oxytocin. Okay. Cortisol stops it shuts down your ovary automatically. Okay. Why? It takes you to, remember that fight, flight, fright. I'm Kikuyu. That one. Fight, flight, fright mechanism. So where is all the blood shunted? To your fertility organs, do you think? No? No. It goes to your heart, it goes to your muscles, because it thinks you're about to run. Yeah? So if you're trying to conceive with that in your body, it will not work. Okay. It will not work. And if it does, it's going to be a difficult pregnancy. Because this baby has come from a high stress environment. And because God is God, He'll not allow. You understand? So, mimba haitaki pressure. Sawa. Nimwapea hiyo, mumekimbia nayo, haitaki pressure. Haya. Now back to anatomy. Guy. Back to anatomy. No, now is at physiology. I was telling you the clear discharge and how it looks like. So on the first day, it's, okay, of course you get your menses, 4 or 5 days, whatever, and then you can get like a brownish discharge. It's a remnant of blood, okay? And then that clears, and then you have a gap where there's really not much. It's just clear, okay? Those are your safe days, guys. Those ones where there's not much discharge coming out, those are your safe days. Please, don't use this at home unless I've taken you with your cycle dates and I've counted for you, but this is just general for your knowledge. When you start seeing that mucousy discharge, it will start as small, and then by day 14, if you have a 28-day window, it will be stretching and long. Those are your fertile days. Okay. And what has happened is that your body is shifting from an acidic pH to a more neutral pH. Okay? To allow that cervix to open up and receive what? Sperm. So after you ovulate like this, in 2 days, that place seals shut. Okay. So that clear discharge now becomes more white, more matty. Okay. It's more matty. And then it's canty. It's not so much. Okay. And then it goes all the way till day 14. By that time, you switch now back to blood. Day 28, and then now you start bleeding again. Okay. So all that, you can hear there's some type of discharge coming. Not so much, but there's some type of discharge. Okay. So when you start seeing discharge that is enough to stain your panty, like your panty is wet, problem. You understand? Because the amount that should come is about a teaspoon. A teaspoon should not be able to stain your panty unless you're ovulating and you're the type who you get a bit more discharge, but it will be that sticky long. That's why I'm insisting on the sticky long. Okay. So if you find that you have green discharge, yellow discharge, gray discharge, all that is abnormal. Okay. Have you seen anything in nature that is green other than vegetables, like a green fluid that is normal? Even one. Even one. In nature, even one. The only one is bile, and its work is to kill toxins. Imagine. So if you see green and it's a fluid, you know that it's not normal. Okay. The other one is yellow. Yellow, flowing like water, not normal. Okay. Gray. Gray is usually bacterial vaginosis most of the time. Also not normal. Okay. If you start seeing that it's frothy is a sentence, in kind of bubble. No, it's not normal. Sour. So anything that is not clear or white and that I was talking about is not normal. Okay. For white, when you know it is not normal, it will be more of cream, it will be thick, it will be curdled milk. Sour. So anything other than that is not normal. And what do? You go to the pharmacy? Yeah? You go to the pharmacy? No. Okay? You can see your gynecologist and they will help you out. Or you can study your pattern and see what could be the trigger. If you had taken antibiotics, you know that it could be that. That is what has offset your cycle. You call your doctor and they'll sort you out. Okay. All right. So I've talked about the color. I've talked about the consistency. Yeah? And then if you find that this discharge is coming outside your ovulation, for example, window, then it's also not normal. If you're meeting with your partner and afterwards there's bleeding, okay? If you're meeting with your partner and afterwards there's bleeding, it's not normal. Understood? There are those ones that you tell me, Doc, I think it was rough. Fine. But if it's every single time, it's not normal. And what does it indicate? Are you saying that cervix where it is? When you have any discharge, it stays in that whole tract. Okay, see that 10, 11 centimeters. It will be in that 10, 11 before it gets to your panty. So you can see how far it has come from. So sometimes you tell me, Doc, I don't have a discharge, but I'm itchy. So when I open it, a speculum, what do I find? You understand? Yeah. So when you have that discharge, it goes and settles on the cervix. So as it settles on the cervix, it irritates the cervix. And then consistently, as it's irritating the cervix, you get something we call a strawberry cervix, or a cervix that is easily bleeding. Okay? And that is a type of infection. Most of the time, it's TB, Trichomonas vaginalis. Okay? So when you see that, please come to hospital. It's one of the things that allows that cervix to open up. If that cervix opens up, then that infection goes up. When it goes up through the uterus and to the tubes and down. So have you seen women who have struggled to conceive? But they tell you, I was once treated for pelvic inflammatory disease. That is the cause, okay? That you got an infection, it wasn't cleared early enough, it went up, okay? It went up, it started irritating, it just irritates, like it's burning through the lining of the uterus, and then it goes to the side, it starts burning through the tubes. The tube is a very thin organ. So that organ, if it's irritated enough, it's going to form adhesions. So an adhesion is like, ukikatwa, see, it forms a scar. So an adhesion is scar tissue up wherever it is, whether in the uterus, whether in the tubes, wherever it is. Okay, and that is what will cause you infertility out of infections. Okay, so that's why it's very, very important for you not to ignore an infection. Okay, and now you can identify how it looks. I hope you can identify how it looks like. Cindy, today we are only here to learn normal versus abnormal. That's the whole agenda. Normal versus abnormal. Okay, so the other thing that can happen if you ignore an infection is that cervix can get infected with a virus called HPV. Who has heard about HPV before? HPV, yeah, human papilloma virus. So human papilloma virus is the causative agent for cervical cancer. Okay, but remember your body can heal itself. I don't know how to pass this on. Your body can heal itself. So if your immunity is strong enough, your body actually fights off the virus. Understood? And when it fights off the virus, you don't necessarily get cervical cancer. And it takes a good 10 to 15 years for someone to develop this cancer. However, when we find the cells are turning abnormal, and they start turning abnormal where that arrow is. Are you seeing the arrow showing cervix? You're seeing that arrow? Yeah, that's where it starts turning abnormal. So when we do a pap smear, we are going with a brush. It's actually just a brush, and then we do this. We pick up the cells, we take them to the microscope, and we check. Are you getting abnormal cells or not? And if you are, we have treatment modalities, and of course we boost your own immunity so that you don't go all the way to cervical cancer. Understood? And this is checked once a year. How often? So how often should you see your gyna if you have no issues? Once a year. Okay. All right. So tracking back. Oh, and if you have an infection, by the way, is that rain? It's rain? Okay, we thank God. We thank God for rain, if it's rain. So the other thing which means we can have more time. So the other thing that happens is that this inflamed cervix can get blocked. Okay, it can get blocked, something we call Asherman's. Asherman's is when it goes up to the uterus, or cervical stenosis. Okay, so you're having a lot of intimacy with your husband, but you're not getting pregnant because that whole tract is blocked. Remember, that gate is a really tight gate. It has to be willed by the body to open up. And if there's a band that is blocking it, it will not open up. Understood? So that's another point as to why people may get fertility issues because of infections. Okay. Now, you've all heard about the coil, the wonderful coil, IUCD. Okay. So the coil sits at the uterus. Okay? It sits at the uterus, and then it has a T junction like this, and then it comes down. For us to be able, it's very short. A coil is the length of the urethra. It's 4 centimeters. It's very short. But it has to give us, we have to leave a string so that we can get it. Okay, so because we remove it after 5 years, 10 years, it doesn't matter. We have to remove it. Sindio. So we leave strings. Sindio. Yeah. These strings, we used to tell women, you go up with your fingers and then you check for the strings. Okay? Your fingers are very sterile. Sindio? See, your fingers are very sterile. Munahanga meziosha na jik. Is it? Yeah. So we now advocate for you not to go checking. Why? Number one, you can introduce an infection. Because the bacteria in your hands, and there's a lot, are not the same bacteria down there. Okay. So we don't want your fingers there unless with reason, unless we're going with a drug or whatever it is, and we'll tell you, please wash your hands thoroughly and all these things. Okay. But you go in and you feel, and then as you're coming, remember your fingers will do this. Simple. You clip the thread, and then you do this. And then you leave it in the middle. And then you come tell me, Doc, you put for me a coil and now I'm pregnant. I'm like, yeah, you pulled it out. You did. You get? So, that coil, the strings, if you have an infection, and it's a chronic infection, it can get to those strings. Remember, the strings are plastic. So now what do you have? You have a factory of bacteria. You understand? Why? Because you ignored the first infection. Okay. So you have a factory of bacteria, tunakuponya, tunakupatia dawa, unakunywa siku 3, unakaa wiki 2, you come back, doc. Yeah? Then you go back again, 3 weeks. But until we address that string, there's nothing we are doing. Okay. So sometimes we'll pull it out. We'll give you time to heal with maybe whatever antibiotics or whatever it is. If it's a protozoa, we give you an anti-protozoa. You get? Whatever medication. So we give you medication for 2 weeks, and then we allow the period to come. Then we put another one, if the coil is the only method. Because there are people who, you can't do hormonal, you've tried counting, you have counting babies, you have condom babies, you have a Jadel baby, we're back in a coil. Yeah? So for the people who those are your only options, then we can guide you. You first take a pause, use those condoms, you pray to Jesus, and then we put another one. Okay? And remember, nothing is clear cut. Nothing is 100%. Not even tying those tubes is 100%. Okay. But that is what we would guide. Also, the people who go to whoever, midwife, nurse, doctor, it doesn't matter, and you're insisting, my husband is coming back next week, put the coil today. And then I've checked and I'm telling you, you have an infection, I'm not going to put this coil. You're like, no, doc, if you're not going to, you go to another doctor. So this, it makes me so upset because that tract has an infection, right? That coil, even as it's sterile, it's going to go through that tract to get up to the fundus. And you see how high it's going. So what are you doing? You're taking the infection up. Okay. So when we tell you, pona kwanza ndo come, see, we don't want you to abstain. We are not after your marriage. Imagine, we just know we know the effects and we're trying to prevent it. Okay. So please work with us as well. The third thing is, now I'm still fully on abnormal. You have an infection. We've treated you. Okay? We've treated you with a pessary 3 days, 8 days, doesn't matter. Then you stay, you get your periods, you come back. Then you tell me, Daktari, that infection is back. So what happens is, we treat you, but we don't treat your husband. Lover of your life? Sindio? Lover of your life was with you when you had that infection. Sindio? And then, akangoja upone, juu mgonjwa, ukamaliza dawa ukamwambia, babe, we are ready. Sindio? We are ready akakurudishia infection yako, bebana. Okay. So whenever we treat an infection, we also treat your partner. Understood? And you really need to explain to him that if he is not treated as well, that he can return it back to you. And the organs are very external. Okay? So let me give you an example. This hand is very external. Sindio? So if I touch the floor and I come up, and that floor, my baby had thrown juice or something, will I not come back with that juice? Sindio? Okay. Sorry, it's stabbing me. So I come back with the juice in my hand. Will I see it? Will I see it? Usually not. Sindio? And then I go and forget to wash my hands and maybe cook. So nikikata nakata nyanya. What am I doing? Flour, nyanya, together. Sindio? At least that one we have the benefit of it ingia kwa moto. Sindio? Then after that I decide, let me eat this nyanya as I am cooking, or meat to make it worse. Acha nionje. Unaendanga unaosha mkono ndio uonje. Tunachuanga kakiji. I'm not a chef. I'm not a chef. But so you usually take the mwiko, unachukua unauma, chumvi bado. Sindio? Okay. Lesson number 1, wash your hands. But lesson number 2 is that the same thing happens. When your husband meets with you and you had a discharge, he remains with that discharge in his hand, in his penis. Okay. And the bacteria that are there, unless he's showering with G-Dettol and G plus 'Wood, it's not going to be 100% removed. You understand? Okay. And remember, there are also other organs there, like the scrotum and the hair and whatnot. All that is going to pick up that infection because your fluids touch. Sundio. So when you meet again, all that is going to be deposited back. And I'm not telling you to go tell your husband to wash themselves with jik tafadhali. That's not the message of this class. Okay. The message is, if you're being treated, you both have to be treated. And your body actually takes time to adjust to your partner's bacteria. So when we say you are one, we mean it, even biologically. If you've been together for 3 years, your body understands his microbiota. You get? The bacteria around his penis, your body understands. Even around his mouth, because you guys make out. Sorry for being weird. But it understands it. That's why when you have coitus with a man who's new and then you get pregnant, you can get preeclampsia. Okay? And I'm not saying all women who get preeclampsia had a new partner, but it's because the body has not adjusted to his DNA yet. Okay? So it starts fighting that DNA. Stories for another day. But I'm trying to say that we have to reset both you and your partner so that your microbiomes remain almost the same again. Understood? Yeah, so you are one. So whenever he asks you, because the men who will refuse. The men who? It's the men who will refuse. Ama the ones I know are the problem. You know, perhaps these ones of JCC are amazing. Okay. So for the ones who refuse, for those ones out there, not you, for the ones out there who refuse, you guide your friends, advise your friends, yeah? That whenever they go to the hospital and they've been told they have an infection, this works 100% of the time. So due to Zime Facebook, this, good. So that 100% of the time, what happens is you go tell your husband or you tell your friend to tell their husband, Doc told me I have an infection. And because I have this infection, we don't want it to get to you. So to protect you, take this drug, and then you will be fine. Okay? You don't go saying, no, Doc said we have to that nipone lazima pia wewe. Okay. You go tell him, I was told this will protect you. Sawa. There's a friend of mine who told me that we were trying to do fertility. She's pregnant now. We were trying to do fertility treatment, but the husband was not for it. So she told me, Doc, I'll sort him. I'll just tell him, COVID is going around and you need this supplement. Imagine she did it. And it worked. They didn't get COVID, but now she's pregnant. You understand? So what Pasi was talking about, a submitted woman is the one who gets her way. Or rather is listened to capture it the way it was said. Sawa. So, 2 minutes, mko serious? Okay, achani. Backtrack. So, I've talked about why you get UTIs, right? You've understood? 15 more, thank you. Nimeambiwa 15 more. So, thank you. So, why do you get UTIs? Because of that short tract. Okay. So, what can you do about UTI? One, if you're using a shared space, if you're using a shared toilet, and sometimes it becomes difficult to manage, but what you do is flush the toilet first. I'll just skip to what you can do now. Okay. Oh, thank you. So, flush the toilet first. So you've gone to, where now? You've gone to a mall, you are taking your keys, whatever, you need to use the washroom. Something that I've learned works, and maybe if now I tell you it will not work, but we are few women. 40 million and us to go to sour. Go to the last toilet. Okay. Always go to the last. Most people don't. And msene mambiane juu sasa si wote tutenda the last toilet. So watu wote wakenda last wenda ya kwanza. But go to the last toilet. Because most people will not. When you find a clean toilet, and you can judge with your eyes, flush it. Okay? Before you start using it, flush it, because sometimes it can splash up. Okay? Right. So you've flushed it. Second, put tissue. Work with tissue if you can. Put tissue as a base down there. Put tissue at the top. Okay? So that if it flashes, it's getting absorbed by the tissue. It's not just for any reason. Okay. God help you that you don't need to sit on that toilet. You're not going for your legs, and like you can support your body. This is why we need to work out. Okay? But assuming you're not able to support your body, have what is this thing called? 100% alcohol. What is it called? Sanitizer. Work with sanitizer that you can spray. So spray the toilet bowl, then put tissue on top, then and only then you squat. Okay, but if you cannot sit, if you can't squat, then you can sit. But ideally just squat. Okay. If you have an option of using pit latrine versus ya kukalia, which one do you go to? Thanks. That one you know. Okay? Then after all that is said and done, you put all that tissue back and then you flush. Remember, you carry the microbiome in your hand. So wash your hands. That sanitizer, sanitize your hands. It's a bit more sterile than just washing hands with soap. Understood? Okay? And then if you can, drink a lot of water. Why? Anything you might have picked up over and above, you can flush it out with water. Sawa, sawa. Yeah. Teach that to your girls as well. Oh, and of course, front to back. Front to back, by now we know. Cindy, front to back. Okay. So why postcoital discharge? Postcoital. Why would you have discharge after sex? Is because of that pH issue, number one. Two, that's naturally. Now, naturally, why you would get that. But out of natural circumstances, it could either be it's a recurrent infection, you're being reinfected by something you had before, or there's someone out there, God forbid, who is introducing infections to your house. Okay? Ask for the wisdom of God to know which one it is, and to deal with it as you will be led. Sindio? But if you keep noticing recurrent discharges after coitus, please have you both treated. Sawa. And before you run to say, you're the one infecting me, who are you sleeping with? Na. Remember, his pH and yours are not the same. So I'm not excusing, because I know we're in the Church of God, but we are still human and we see these issues. But before you think too far, first think about, did I have an infection? Was I treated? Was he not treated? Think about, is it a pH issue? Look at the time of the month that you're in. Understand? Then if all that is not, then now you can go thinking other things. Understood? But bottom line, both be treated. Sawa. Now, after having coitus, it's important for you to go to the washroom, to pass urine. Very important. Within the first 30 minutes if you can. Okay? You may be tired. As someone asked me if we can pass out. Was it in this forum? Yeah, the people who pass out. Yeah, the people who pass out. It's because of high release of oxytocin. It's normal. It's physiological. It also means you could be dehydrated and you worked it for too long. But if it's an occurrence that is consistent, then you need to look at, it's just the effect of oxytocin. Sawa. If that be the case and you're one of those ones, please tell your partner to wipe you. All right? Yes. So number one, pass urine. Please put me back on the urinary tract, the female reproductive tract. Thanks. Yeah. So you pass urine because of the bladder. You can see the closeness of the vagina to the urethra. It's a very short gap, okay? So when you pass urine, if you had picked up anything during the act, then those bacteria are flushed out by your urine. Understood? So they don't get to go up, they're flushed out. Okay, that's the logic. Number two is you need to wipe yourself. During my tara, I was told to have a thermos, hot water thermos. Who was told this? Who was told this? You were told? And a clean cloth. Who was told that? To wipe my king. Please wipe yourself as well. All right? Why? Again, because of pH. Yeah? His pH and yours are different, so you want to just wipe the perineum. Don't go with it up the vagina, tafadhali, no. Just wiping outside. And you're wiping dry. You're not scrubbing. Si uchafu. It's nature, it's okay, it's fine. Just wipe what is excess so that it doesn't start culturing bacteria. Sawa, sawa. Then whatever remains inside will get you pregnant, and that is good. Okay. Or not, depending on where you are in life. Sawa. The other thing is, if you are adventurous and you do anal things, tafadhali. Please. First of all, it can be very, very harsh. It's not how the body was intended to act or to work. So it's very painful. If you have things like, if the partner has things like, let's say, HIV, for example, it's very easy to get any sexually transmitted illness that way. Why? It lacks the mucosa that the vagina has. It lacks the acidic pH that the vagina has. Therefore, it is unable to protect you from these common sexually transmitted illnesses as the vagina would. You understand? So it's not natural. If it's not natural, leave it alone. But if at all you do, because I agree that things can happen, tafadhali, if you've been from the anus, do not go back to that vagina. Please, 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 please. You bring so many bacteria into the wrong canal. Sawa, sawa. So let the vagina do what it was meant to do, and then let the anus do what it was supposed to do. Tumeelewana? Tumeelewana? I'm not coming for your bedrooms. I'm just here for your health. Sawa. Okay. Now, postpartum. So you've delivered your baby, and then now down there just feels weird. It's not the same. You come and tell me, Daktari, after giving birth, sex is just, I don't feel it. I feel abnormal. So what happens? You see this yellow in between? Are you seeing this yellow? That's fat, but below that fat is something called the perineal membrane. It's a sheet of muscles, very thick, very deep muscles. Okay, so those muscles are the ones that we cut when you're giving an episiotomy or that tear during birth. Okay, they heal, thank God. But if they heal badly, or if for whatever reason you are scared of getting the cut, whatever the case, or you just tore by mistake, that muscle remains very weak. Okay, and remember, the body will heal back to where it can, where ideally it should go back to exactly like this, but if there's a gap or there's a weakness, that's where it will remain. Understood? Therefore, it is important for you to know you need to do your Kegel exercises. Okay? Any muscle needs to be worked. Understood? Any muscle needs to be, including your brain and your heart and your legs. But these vaginal muscles are forgotten very many times. Okay, so these vaginal muscles, if they're not worked for whatever reason, what happens is then they become lax. So first, it's a gaping hole. It will come back to slightly normal, but it will still be a gaping hole. Then after that, you start feeling like your bladder is falling. And then anytime you pee, you can feel there's something bulging down there. The last thing I have seen is that the whole uterus can fall. Okay. That signifies a very weak, very, very weak muscles or the ligaments that support it, but it can happen. Okay, and because I've had the experience of seeing from the worst to the zero, then I would guide that if you've had a child, or even without a child, if you can do those, if you can exercise those muscles, then you're at a better place. You can even control your own coitus experience. You can actually, because you clench, you release. You clench, you release. Okay, so for those of us who may not have started to do it, when you go to the washroom today, when you go to the washroom and you're passing a short call, I want you to count 1, 2, 3, 4, 5, then hold. It's like you breathe in and hold. Okay. So you hold and count 1, 2, 3, 4, 5. Initially, utafika 3. Then, then you release. Then 1, 2, 3, 4, 5. Then you hold. 1, 2, 3. Then you release. Do that when you start to pass urine. Every time you start passing, you go to pass urine, do that. Okay. Then once you're out of there, now start doing it outside the washroom. You just need to count 1, 2, 3, up to 10, then release. Okay, you are exercising the anal muscles, you're exercising the urethral muscles, you're exercising the vaginal muscles at the same time. You understand? So, tunaifanya kama dawa. 10 times 3. Sawa? Meshika, 10 times? Hivyo tu. 10 times 3 for the rest of your life if you can. But just do it for a month or 2. Tell me if you're not going to feel the difference when you're controlling your bladder, when you're with your partner. You understand? 10 times 3. Meshika, to practice. Tufanya tukimaliza. Kuna 4 minutes. Ndio? Okay, tutafanya tukimaliza. So what happens in pregnancy is that your ligaments start becoming loose, and then your muscles become loose for the reasons I've told you. And even if you've had a CS, those ligaments and those muscles are still weak because you were carrying 3 kilos here, it was pushing down there. You understand? So whether you had a CS or not, it's not your caveat. Mimi nilifanya CS, mimi niko sawa, please, eh? Okay. 10 times 3 kama? Dawa. Yes. Menopause. Now, in menopause, your estrogen reduces. So, if we have that image of the ovaries and the uterus, the ovaries are what produce the hormones required, thank you, the hormones required for your vagina, your uterus, and the whole tract. So what happens in menopause is that is reduced. The production of these hormones reduces. And that production, as it reduces, the other thing that happens is that this vaginal tract now is getting less secretions. Those less secretions now makes the muscles thinner. Okay? It makes it very easy for you to get an injury, and it makes the area very dry. Sour. For some people, they can also get some itching, something we call lichen sclerosis. So some people get itching. That same hormonal deficit is what will give you hot flashes. Okay? Scientifically. What is a hot flash? It's when your body is realizing that you don't have enough thermoregulations, like your body is chilled, so it gives you a wave of heat to heat up the whole body. Because one of the things that estrogen does is that it regulates your temperature. That's why they say tumepata jiko. It's physiological. Your body actually is able to create heat. You understand? So with the loss of estrogen, that it's not complete loss, but there's like a 60 to 70% reduction of estrogen. So with the reduction of that estrogen, what happens is the body is unable to regulate that well. So it gives you waves of heat. It says again, waves of heat. Okay, so the only way to manage that is to reintroduce estrogen or to get used to it. Okay, because your body at a point will understand this is the new rhythm, and then it will reset itself. Okay, so it finds a new normal. So menopause or perimenopause, because that happens in that season where things are changing, is a season of change. You need to understand it's a season. It's a season of change. The same way we know in pregnancy, I know in pregnancy I get a big nose. Yes, Terry? I get a nose from here to here. So it's a season. I know after my pregnancy, my nose will come back to normal. Sindio. So the same thing, menopause is a season. Perimenopause is a season. So what initially happens is that your periods will become more. You get your periods after, you got it on 1st, it's now back on 20th, and then it's back on 15th, then now it's 10th, then it's gone for 2 months, then it comes back. It's very erratic. Understood? So first it becomes more, and then it reduces to become 2 months delay, 3 months delay. And then when you hit a year, 1 year, without seeing blood, then you're in menopause. Okay. And after you hit 1 year without seeing blood, and you see blood, it's a problem. You get me? So after 1 year of not seeing blood, if you start seeing blood, it's a problem. We call it postmenopausal bleeding. Understood? So if you're in menopause, you need to understand that your diet is now what is going to help you, because your body is not creating enough estrogen. Okay, so you look for foods that are estrogen rich. So, what are foods that are estrogen rich? Let me tell you. Sorghum, yam, doma. Yeah, those things you don't like. Yeah, especially yam. Yam is very good. Okay, just look for estrogen foods. But there's also a bad type of estrogen that comes from fat. Okay, so if you find people who are generally bigger, their menopause is also bad. And it's physiological, because the fat here is converted to estrogen, and then, okay, the effect is not that bad. I am not telling you to get fat, please. Please, please. What I'm trying to say is that the body will still do the same, no matter your body size. It will try and put fat from a river, glycogen from a river, and convert it to estrogen. Just that the estrogen that's being produced is not as much as your ovary would have produced. Okay. Then estrogen also does something. It protects your joints, your legs, and your bones generally. So estrogen protects your joints. And we know that all your joints and all your bones require calcium, sindio? Something called phosphorus. Mnakumbuka Afrika hizo? Sindio? So that is why we tend to put women who are menopausal on calcium and phosphorus type of supplements. Okay, so now you understand why. So why does the body shut down? And this is now for thought. Why does the body shut down your estrogen? Why does it remove your capability of getting pregnant? Why? Scientifically, we actually are the only mammals that go through menopause, that and monkeys. And the reason that I believe, it's not scientific now, the reason that I believe is because of a thing that was written in the Bible, that older women need to teach the younger women. Okay, so we have evolved to be able to get grandmothers. We are the only living creatures that, thank you, Titus 2:3, the older women likewise, that they be reverent in behavior, not slanderers, not given to much wine, which is what happens, teachers of good things, that they admonish the young women to love their husbands, to love their children, and to, last verse, to be discreet, chaste, homemakers, good, obedient to their own husband, that the word of God may not be blasphemed. So we have evolved as creatures, scientifically now, to be able to have a nurturing effect on our young. It's a God-given capability. Most of the CEOs who are CEOs and women, they're in that menopausal age. We are working to fight it. We are working to go there in the boardroom when we are young. But the leaders that we have who are that age, you have the experience of years and wisdom. Some of the best advice I get from my mom. She's like my personal therapist. You understand? So when you're in that season, you need to remember that it's not a punishment. It's not a punishment that you're getting like a sudden wave of heat, sorry. It's not a punishment. What is happening is that your body is now allowing you to move from an incubator to now a teacher. You understand? So allow it. Just allow that wave to pass. Support your body. Realize that now I need more bone growth, for example. Now I'm taking, and you will find yourself naturally gravitating towards those things. You get to a place you're looking for soup. Everyone's like, Mom, you're looking for soup. Why? Your body's looking for calcium. You get? Yeah, until now I'm eating healthy, I'm eating doma. Your body's looking for estrogen. You understand? So that's just for you to know. So now, the last thing I want to talk about is the trends, and then I'll close. We have vajacials. Meskia vajacials, vagina facial. What is that? Vajacials, yoni pearls. come and tell me, Doc, is it okay? My friend was telling me that she got a yoni pearl. Can I also go get one? Huh? There are these things that are happening that people are trying to, they've gone to the other extreme of really beautifying that area where you think that you came to this earth to be a sex god. You're going to massage and then to exfoliate. What are you exfoliating? Why? Anyway, these trends are they're good. They're trying to keep that area clean. However, they can really change the pH. Remember that pH I was talking about? They can really change the pH of that area. And there are cultures which it happens. It's a natural thing. You get kuni, not kuni. What's this thing? Stove, not stove. Ikitu ya tatu inaitwa? Iyo, yenye mnekanga makaa, what is it called? Jiko. You get a jiko, and then you put neem, and you put all these other herbs, and then that smoke, you go and sit over the jiko, and you try and steam it. It happens. And there are some benefits that have been seen from them. However, the cases of burns we have seen from such experiences are so many that it's not worth it. You understand? Again, remember the vagina is self-cleaning. Sawa. The vagina is self-cleaning, so allow it to do its work. The only place you're allowed to put anything, to wash anything, is outside. And you don't go with Dettol because you're trying to keep this area sterile. No. You will kill off the good bacteria as well. Just a mild soap. Okay. And remember, it's only for outside. And there are also these femi washes. There are some that are okay to use, the ones that have a pH of 3.5 to 4.5. However, they're also still only for outside, okay? The best thing you can do for yourself to take care of that area is get cotton panties, okay, that you wash and dry outside, okay? And then once it's dry is when you use, number one. Number two is wash that area in the morning or whatever time you're doing a shower. That's it. Drink a lot of yogurt or anything that is a probiotic or a prebiotic. Okay. When you get this book, shameless plug, when you get this book, it will tell you the type of foods to eat. It has a recipe. But if you can eat oats, that's also a really good thing that you can do for yourself. Okay, so let us use food to help us in these seasons. You understand? Over and above, things like moringa. If you can drink moringa, well and good. Going to take it down there, please don't. Sour. I'm putting lavender oil so that I smell like flowers. You're not supposed to smell like a rose, my dear. Okay? It has its own scent. Allow it. And it will tell you, if you start noticing your scent is changing, it tells you there's something happening in your body. Okay? It's like an instant, there's a problem. Too much toxins, or you get. You understand? So, and learn to know these are the changes. Oh, we eat watermelons and pineapples. They are good for hydration. Okay? Very good. Excellent for hydration. They hydrate you, and that makes the taste there a bit better. Okay? So they don't make you taste like pineapples. Okay? However, they do make cement taste good. However. Okay? So if there's someone who's supposed to eat pineapples, your husband, not you. But if you eat them, well and good for hydration. You understand? So the other key is to remain hydrated. Sawa. So remain hydrated, take probiotics, take prebiotics, and then just cotton panties, those things that are tightening you, and you want to get an extra bump, so you're putting this, those are the things that are giving you issues. Sawa. Okay? Loose clothes if you can, very good. If you can sleep without nothing, even better. Okay? So I think I'm at the end of my time for the third time. Thank you. I want to say thank you. I've not discussed PCOS. With permission, I'll come another day maybe and fibroids and discuss about them. But for today, I just wanted to focus on what's normal and what's abnormal, and to tell you you are wonderfully and fearfully made. Okay. And you want this real woman to be a well woman. Okay? We want you to be custodians of this body that you've been given. Okay? And to be able to go and advocate for yourself at the clinic. Go talk to the gyne and tell them, this is what I'm noticing, this is what I'm seeing. Eh? Si tunaenda clinic nakuja na husband alafu ni anasema na ako na kauchafu. You know how embarrassing? That's so embarrassing. You get? Yeah? Ama umekuja mtoto ndo ako na homa, alafu naambia daktari nanaweza kuuliza kaswali. Ebu toka nje, ebu toka. Then now you ask your question. Please prioritize yourself. If you love yourself, that love permeates to those children that you love so much, that husband that you love so much. It gives you self-dignity, it gives you glow. Because you've understood the person that you are, and you love this shell that we were being given. This shell is supposed to take you for 100 years, or for how long it will take for you to have your purpose. If you don't take care of that, if you don't take care of your house, kunyesha kutadu. You get? So think about it that way. You are given this body to have authority in this earth. For you to have that authority, this body must be capable. What if you were sent to India, for example, and you're supposed to be a missionary to every state of India? There are so many. That country is bigger than our continent. You think if you can't walk 10 steps or 1,000 steps, you're going to make it? Your body will collapse. You understand? If you are supposed to raise a generation of able children, but you eat everything. But mama kula shika ni tamu. You've eaten 15 spoons by the time your baby has eaten one. Ukimconvince, ni tamu. Umekula uko spoon 20, baby ako spoon 3. Are you not going to get big? And then you hit 40, your heart starts failing. Who's going to raise these children? You've not even reached that age of menopause that you were already ordained to teach the younger. So if we're not able to take care of the bodies, who is going to take care of that young one that you love so much? Who? So tujipende, God loves you, I love you so much, and thank you so much.
Amen.
Yes. Question.
I think I don't like that. How does somebody now, we have learned about the pH and the importance of the pH. We have seen what triggers it, to make it a ground for infection. So how does somebody now maintain that pH so that now it remains at that acidic
pH?
Yes.
Okay. So you need to know that to be able to maintain this pH, is it me?
No, it's me. It's okay.
So to be able to maintain this pH, those things that we're talking about, prebiotic, probiotics, they are natural acidic foods. Okay. Things like garlic, things like neem, things like turmeric are naturally acidic. But what you just want to do is to create an environment where the body can do it for itself. Okay. You don't want to go to take garlic. It's actually a treatment method. Here you will see it. It's actually one of the treatment methods that people use in China. They take garlic, they close in a cloth, and then they poof inside there. And then you get a chemical burn. Okay. So instead of that, when you really hydrate yourself, you are able to remove most of the toxins. Okay? If you're getting an antibiotic for any reason, for example, because that you know for sure, naturally it will kill off this good bacteria, tell the doctor that please also give me something to counteract the effect of the antibiotic. So we give you probiotics as well. There are probiotics that you can take that mimic those of the vagina. Okay? So if you're able to take natural probiotics, well and good. But in case you get sick, because most of the issues are not when you're okay. Most of the issues are when you are sick. That's when the whole body shuts down. So if you're unwell, please take the natural probiotics, but now you can go and ask for the feminine and probiotics. This one I can't even, they're off the counter. They're called, like one very good one is Everlife Femiflora. Okay, I've not been sponsored, but Everlife Femiflora is a good probiotic. Okay, there are some that are pessaries that are called Vaginal good pessaries, for example. If you're having coitus and you're starting to feel pain for whatever reason, the first thing you do is get KY jelly or get a lubricant that is water-based. Okay, so that also helps with that moisturization, doesn't affect the pH so much. Whatever lubricant you're using, Kenya last year, it will affect you. Please, it has to be a fresh tube. You bought one when you're married, 10 years down the line is when you're feeling pain, you're getting that tube for life. Please don't. Okay? Tujipende. Sawa sawa. And I say this because I have patients who got a reaction or an infection because of using old lube. There was nothing wrong with the lube, it was just expired. Okay. So the other thing and the main thing is just remain hydrated. Just remain, your body will do the rest. I promise. Your body will do the rest. Remain well hydrated. Take your 2 liters of water. Semekana wenule office babe wa maji, it's fine. Okay? The people who use lemon in that water, it's okay. Because again, lemon is acidic, it helps as well. But it's not coming from your mouth down there, but it will help restore the stomach pH going down. Sawa sawa. Yeah.